Hello, we're going to go over the supervision models, and these are very much you're going to have a basis of the feel of these from your clinical theories. So there's going to be some similarities and overlaps. So it shouldn't feel like all new information. We have to recognize that just like with people that we work with as clinicians, we have to know different strengths and challenges and worldviews that our clients have. You have to understand that that's the same because we're all human beings. And so when you're the supervisor, and know that when I provide this lecture, I'm talking to you as if you were the supervisor being over supervisees. So when I talk about you, I am referring to you as a supervisor in this role. You have to know the people that are working under you as a supervisee, what their strengths are, how their worldview impacts their services they provide, and that's how we work with them to be the best that they can be. We have to know them. We have to recognize who they are. There's a lot of different ways that we fulfill the role of a supervisor. The first one is educating. So that is a whole lot of like assessment, evaluations, um, helping people have learning experiences, build their knowledge or skill base, just learning basic skills. Those might occur, that type of supervision might occur a whole lot in your clinicals, your last year of school, or as a new counselor. And then you have administrative type supervision, and that type of supervision is really going to be based upon monitoring workloads, pay, getting notes in, how you enter your notes correctly into a system, what the policies and procedures are of the agency that you work under. And then supportive supervision, which we normally refer to as clinical supervision, really works and focuses on your emotional needs, your ability to take care of yourself, and your ability to provide the service in a very clinical way under very good ethics for the people that you serve. I really like this quote, and so I put it in here for you all to really get that understanding of what this job is about. The opportunity to guide others to their fullest potential is an honor and one that should not be taken lightly. As leaders, we hold the lives of others in our hands. These hands need to be gentle and caring and always available for support. This is a hard job, but it is such a rewarding role when you're a supervisor. Some people might say that providing supervision in and of itself is an intervention. And what they mean by that is that when you're working that close with people that are supervisees, you will notice that you help them grow, you help them become better versions of themselves. You sometimes will be a teacher, sometimes you'll be an advocate, sometimes you'll be a support system. There's so many ways, but you're also monitoring them not only for the sake of their own personal growth, but for the services they provide to other people. Your job as a clinical supervisor is to make sure that they are good at what they do and that they are given proper and ethical services to the people that they're providing for. And so that's a really important role. So that in itself is an intervention. So I'm sure you've heard the definition of insanity, why I keep doing the same thing over and over again and expecting different results. So what we're talking about here is why do we need to learn so many models and theories in the first place? And one of the reasons that we want to do that is because for us to understand the people we work with, we have to be able to work with them on their level, what works best for them, and also what experiences that they've had in their life. And by able to do that is we sometimes have to take off what is normally our lens and put on a new pair of glasses and see the world differently so that we can work with them in a really positive way that meets their needs. So the psychotheory models are psychodynamic, person-centered, cognitive behavioral, systemic, solution-focused, and feminist. So on this next slide, what I've done is I have put a comparison chart to kind of give you an overview really easily to compare what the differences and the focuses are on them. It breaks it a little bit down in the next few slides, but I want to kind of show you this differences. Psychodynamic, it focuses on those unconscious transference, countertransference, the emotional processes, and it's a very reflective supervision, and it focuses on the supervisor and the supervisee's relationship. Person-centered, its focus is on empathy. It's not a directive service. It's a very we know what person-centered is, and it's very much like that in supervision as well. It's about telling you more, making that creative environment, allowing the person just to talk, and the supervisor is a supportive facilitator of the conversation, and they encourage the person to recognize that they have a lot of skill that they know how to use, and they know what to do if they can just learn to trust themselves. Cognitive behavioral therapy is very structured. It focuses on the interventions, problem solving, how you set goals, those type of things. Systemic focuses on that family section. So the questions that those types of supervisors are going to ask are going to be very systemic and family oriented. Solution focus, it's brief. It gets in there, starts to change. It's encouraging. It has a lot of client strengths, built on client strengths, resources, and it doesn't talk a lot about the past. So it's the here and now for sure. And then you have the feminist theory, which really focuses on the environment, the social context in which that person that you're staffing is under. So it's the goal of the feminist theory, and if you were working from a feminist supervision, would be to empower the supervisee, but also helping them to learn how to empower the clients. And there's a lot of advocacy in this one as well. So the first one, like we already said, this I already kind of went over the highlights. So what I want to do is on some of these I was able to find little clips and videos. So those links are in there if I could find them under each one. And so I'm going to kind of give you an idea while you're looking at the slide and reading it. Let's say that we have a 49-year-old female, and she has really been struggling a whole lot with losing weight. And she realizes that she knows what to do to lose weight, but she wants mental health services because she realizes there's so much going on in her head. Constant worry, lots of anxiety. She has a lot of negativity. So the supervisor is bringing this case to you as a supervisor. And so when you think about a case like that, I'm going to give you like one example as we go through these slides of how the different response would be for the focus. And so for a psychodynamic supervisor, their question to a supervisee might look more like, what were you feeling when this person was telling you their story? Did it remind you of anything or trigger you to think about anybody else in your life? Whereas a person-centered might be, tell me more, what else did you learn? That's very interesting, right? Just give me more. Keep on talking. Also, I just put in a quote here by Carl Rogers if you want to take time to read that. I think it's a really good quote. Cognitive behavioral supervisors would have went straight to the anxiety. Let's do some ABC worksheets. Let's talk about interventions. Let's set some goals. What's some of the things that they can do? What skills do you need to work on to provide services with this client? Systemic, they might have said, well, what's the person's home environment like? Like, where's the family? How much family does this person have? Where's their support system? Tell me more about the people that daily impact this person. Solution focused would have been more of a statement that would have said, well, what's the first thing that we can do? What's the first positive step that this person's going to take and be willing to work on immediately about the problem of the anxiety and the worry that they're doing right now? And then the feminist theory would have maybe focused on about what kind of self-doubts and insecurities this person having, and how much of that is just basically from the environment in which they live. Like, how are they feeling because they feel overweight? What does that mean to them? And so hopefully that gives you a little bit of idea of how the focus, they're all supportive. They're all really good ways to supervise people. It's just the focus of the lens that you're looking through is going to be a little different. The next one we have is developmental models. And under developmental models, they all are really good too. You're going to see that all these are really good models. But this one really focuses on the developmental stage of your supervisee. The integrated developmental model focuses on three basic structures. At what level does a supervisor, as you as a supervisor, what level do you need to give autonomy to the person you're supervising? To what degree are they able to make decisions on their own? What are their confidence levels? What are their skill levels? Then you have to assess their awareness, their self and other awareness. Do they notice things? Do they pick up on uncertainties? Do they know how they actually behave that impacts the clients that they serve? What are their own internal fears and things that maybe they are not aware of? And then their motivation. What is their strengths and weaknesses when it comes to helping them help clients? When you think about these developmental models, you want to think about the fact that they are really focusing on professional growth. And so you think about the different levels, like when you look at a supervisee's developmental level, what is their knowledge? What is their skill? What is their emotional maturity? When you think about contextual factors, you're thinking about things like their social, cultural, environmental influences. How do those impact their growth individually? And then you have their own personal experiences that they bring to the table and how important that is and how that allows them to grow once they understand that and are able to use it in a positive way. And it fosters more holistic growth so they can see more holistically when they look at their clients or working with their clients. And one of the things that developmental models realize is that things don't have to be linear. Like you may do well, but you can always revert backwards too. So that beginner, intermediate, and advanced phases of these different developments don't always stay in the same straight line. And this kind of gives you an idea of like the characteristics and then what the supervisee's competencies level. Like if they're anxious, this is a new person, they're afraid of messing somebody up, you're going to be a really supportive person, trying to follow structure. And then you move up to where you might have conflict, you're trying to work with people, you're seeing things differently, you're trying to process cases. And this is like maybe a new therapist where supervision is more about them able to process and understand things in a holistic way. Then you get to an advanced level with whatever situation you're working with, and there's more comfort there and more knowledge there, and you're able to be more of a consultant type role because now the person's very motivated, they really understand what they're doing. So when we talk about the discrimination model, the name may throw you off, but basically what it talks about is where it's also one of the developmental models. It basically is talking about how it discriminates how you react as a supervisor depending on where your supervisee is. So you don't always respond the same. It's about that person's level. And so it talks about how well do they process the case, how well do they conceptualize the case, how aware they are of their own emotions and their feelings and their own experiences. And that lets the supervisor know what developmental level their supervisee is in, and that will also let them know what role that they need to play, whether that's going to be teacher, counselor, or consultant. So again, one of the reasons that this approach is so widely used is it is a very flexible approach, and it gets to be changed and adjusted depending on the level that your supervisee's on, whether they're at a novice level, an experienced level, or as an advanced clinician. And one of the three things that it focuses on is improving clinical skills, professional growth, and also promoting autonomy. And so it allows the supervisor to adjust to whatever level of supervisee they have and provide that service. Other models that we're going to cover is the integrative model and the reflective model. The integrative supervision model, it combines all that all these other theories, all the ones we went over in the beginning, all the psychodynamic theories. And so This one basically is like a pick and choose. It's an eclectic, if you will, supervision model, and it allows you multiple ways of being flexible and tailoring to your supervisee in whatever way that they need, and that is considered an integrative supervision model. Reflective supervision, it focuses on the emotional part of the therapeutic process. It brings up a lot of awareness, emotional intelligence, being able to reflect back a lot to the supervisee. An example of that is I remember one time that I had a supervisee, and they would always staff cases, and I brought to their awareness that did they know that every time they staffed cases with me, some of the first parts of their case staffing, they always talked about whether the person kept a good home, like if it was clean, if it was chaotic, if it was messy. There was always a description in there of their home, and we talked about why that was such a big impact on his conceptualizing the case and how he felt toward the clients he served. And so it's very reflective of the professional themselves. So we've reviewed the top 10 most used supervision models, and they all have their strengths and the reason that some people like some of them more than others. There's a lot to do with how you perceive the world. There's a lot to do with how, when you build a relationship with the supervisee, how that person needs to be supervised. And so you can use multiple factors of these and pull and take from what you like, but they're all really good, strong models. No matter what model of supervision you provide, you're going to provide support and encouragement and value and ethics and all these things into the supervisees to make them become the best therapists that they're capable of being. So it is a exhausting and yet rewarding job, and you really need to show that you have leadership skills in order to do clinical supervision, because some conversations are really hard to have, but they're so needed, and it really helps people grow in a way. So I think it's really important to take a minute and think about what kind of supervisor you would be, but also what kind of supervisor you want in your future. And that is all of our clinical supervision chapter.